Today I am going to discuss about the meconium aspiration. Meconium is nothing but a stool of the baby which is in a green color or black color. Normally the babies will pass stools after birth. If the babies pass meconium in the womb, that means in the mother before the delivery, that will cause some complications. Like if the meconium is going into the lungs, it will occupy the entire lungs, which leads to the baby might require ventilatory support or oxygen support or ICU stay. Depends on the severity. If the lungs are fully occupied with the meconium, it will cause the baby need prolonged ventilatory support. Apart from the ventilatory support, because of the lungs are a crucial organ for the oxygen supply to the majority of the parts. So, if the lungs are severely damaged, there are some complications like brain injury, and heart is in between the lungs. So, there will be the increased pressure in the lungs will lead to the heart related issues, and other organs like liver, kidney may also get affected. But the crucial part is these heart, kidney, liver, these are reversible damage will happen. So once the lungs are improved, usually these parts will become normal, near normal. There might not be the long-term problems will happen to these parts, but the impact might be to the brain. If severely affected, that means oxygen supply is affected severely, the baby may have some neurological issues in the long term also, and the baby probably requires some kind of oxygen or long term oxygen therapy. So all babies will prone for the meconium aspiration? No. Some high risk pregnancies, like if the mother having uncontrolled hypertension, uncontrolled diabetes or obesity, or mother is noticing some kind of decreased fetal movements, these are the signs of fetal stress. Those babies may pass meconium in womb. So we should not neglect and we should follow as per the gynecologist advice. Why? Because if the mother doesn't feeling the fetal movements like previous day, or if the mother doesn't have a controlled hypertension, the baby may eventually fall into the stress, leads to the meconium, the baby might pass in the womb. That we can prevent when you are near the checkups. I mean to say, when you are going near to the expected date of delivery, or you are finding something abnormal, then you have to follow accordingly, then only we are able to find out. There is no single test to find out this baby is going to pass meconium in the womb or not. Whenever there is a stress, there are chances of meconium aspiration or meconium passes in the womb. Not only that, all babies which is passing meconium at the time of the delivery may not aspirate into the lungs. So case to case it will vary, and severity also varies, depends on how badly it is affected. So meconium aspiration is not a completely preventable but curable, and we can prevent some extent, and meconium aspiration have some short term and long term consequences. Usually we have to follow as per the advice by the gynecologist or pediatrician at the time of the delivery or post delivery. Thank you.